Podcast Beauty from Within, The Power of Biotin. Part 1 of 5. Host. Hello and welcome to Health to the Microphone. I'm Wellness Stores and today we begin a 5-part series on a nutrient that has captured the attention of science and the wellness industry, biotin, or vitamin B. Over the next few minutes, we'll explore its benefits, opportunities, advantages, and risks in depth, drawing on the key article by Caracheliou and Livaniou, 2024, and the most recent literature. It will be an entertaining and engaging journey, with anecdotes, clear explanations, and practical advice for all of you. 1. Why is biotin the hair and nails vitamin? Many people associate biotin with stronger hair and harder nails. But what's behind that reputation? 1. Keratin cofactor. Biotin acts as a coenzyme for the synthesis of fatty acids and proteins such as keratin, the main component of hair and nails. Clinical trials in patients with biotin deficiency show that by supplementing with 2.5 mg/day for 6 months, 90% experience increased thickness and shine. Milburn et al., 1999. 2. Energy metabolism. Biotin is essential for pyruvate carboxylase, which converts pyruvate to oxalostate, a key step for ADP production. A better supply of cellular energy promotes hair follicle renewal and keratinocyte division in the nail matrix. 3. True stories. Maria, 35, noticed her nails peeling up to 3 times a month. After 3 months of 5 mg/day of biotin, she reduced her nail fractures to 0. Carlos, an athlete, improved the strength of his nails after including nutritional yeast in his diet, a natural source of biotin. 2. The central role in metabolism, beyond the aesthetic. Biotin is not just an internal cosmetic, it is a pillar of our overall metabolism. 2.1 Biotin-dependent carboxylases. 6 critical enzymes carry bound biotin. Acetyl-CoA carboxylase 1, ACC1, synthesis of newly formed fatty acids in the liver and adipose tissue. Acetyl-CoA carboxylase 2, ACC2, regulates the oxidation of fatty acids in muscle and heart. Pyruvate carboxylase, PC, drives gluconeogenesis in the kidney and liver. Propionyl-CoA carboxylase, PCC, degrades branched-chain amino acids and some odd-numbered fatty acids. Beta-methylcrotonyl-CoA carboxylase, beta-MCC, pathway in the oxidation of leucine. Urea cycle, not classical carboxylase, although less studied. Biotin indirectly influences ammonia detoxification. Why does it matter? Without biotin, these pathways dwindle, accumulating toxic intermediate substrates and reducing energy production. Bhagavan and Chopra, 2006. Obesity and insulin resistance are linked to disruptions in ACC1/ACC2, modulating biotin opens up a therapeutic opportunity. 3. Perfect recycling, biotinidase and holocarboxylase synthase. Our body has designed a circular system to not waste a single molecule. 1. Intake and absorption. It is absorbed in the small intestine via SMVT, biotin transporter, which is shared with pantothenic and alpha-lipoic acid. 2. Free biotin holocarboxylase. Holocarboxylase synthase, HLCS, covalently binds biotin to apocarboxylases, forming active holocarboxylase. 3. Degradation and recycling. When the enzyme fulfills its function and is degraded, biotin, biotin bound to lysine, appears. Biotinidase breaks down biotin, releasing intact biotin for a new cycle, saving us from constant intake. 4. Genetic deficiency. Mutations in biotinidase or HLCS cause severe syndromes, BD and HLCS deficient, which are corrected with pharmacological doses of biotin, 520 mg/day. 4. Therapeutic benefits in rare diseases. Massive biotin supplementation opens the way for precision medicine. Biotinidase deficiency. Symptoms: seizures, ataxia, alopecia, dermatitis. Treatment: 5 mg/day improves brain electronegativity and heals damaged skin. Wolf and Herd, 2003. 4.2 HLCS deficiency. Metabolic symptoms: lactic acidosis, hypoglycemia, neurological crises. Treatment: 10 mg/kg/day during childhood reduces mortality and sequelae. Thavan Robinette et al., 2014. 4.3 BTBGD, biotin-thiamine-responsive basal ganglia disease. Mutation: SLC19A3, thiamine transporter 2. Protocol: biotin 5 mg/kg/day and thiamine 300-600 mg/day, reversed childhood Parkinsonism. Said Ahmed et al., 2014. 5. Beyond, biotin in neurology and oncology. Multiple sclerosis, studies with 300 mg/day of biotin showed initial improvements in gait and fatigue, although one large trial, SPI2, did not replicate all the benefits. Turba et al., 2022. Stem cells and neuroprotection. In vitro assays reveal that biotin modulates cell death pathways and promotes neuronal survival under oxidative stress. Rico et al., 2025. Epigenetic oncology. biotin's ability to biotinylate histones opens the door to anti-cancer strategies that alter the expression of oncogenes and suppressor genes. Gardini et al., 2019. We've completed part 1 of this biotin journey. So far, we've covered 1. Her fame in hair and nails. 2. Its central role in energy and lipid metabolism. 3. Perfect recycling using biotinidase and HLCS. 4. Its benefits in rare genetic diseases. 5. Therapeutic openings in neurology and oncology. In part 2 we will delve into dosage and safety, nutritional levels versus pharmacological doses, interactions with medications and laboratory tests, risks of overdose, emerging research opportunities. Don't miss it. We'll hear from you in part 2 of Beauty from Within, the power of biotin. In our first installment, we discovered how biotin supports essential functions in the body, from healthy hair and nails to energy metabolism and the correction of rare genetic diseases. In this second installment, we delve into recommended dosages, safety, drug interactions, and the diagnostic challenges posed by the use of biotin supplements, all in a continuous and engaging account. To begin, it's important to differentiate between optimal daily intake and therapeutic doses. According to the European Food Safety Authority, EFSA, the adequate intake of biotin for adults is around 30 g per day, a level that covers the needs of most healthy people. However, in clinical settings, the use of pharmacological doses ranging from 5 to 20 mg daily is essential for treating congenital deficiencies such as biotinidase or holocarboxylase synthase. In these cases, tolerance is high and adverse effects are practically zero if administration is properly controlled and carried out under medical supervision. However, when high doses are used, a new challenge arises: interference in laboratory tests. Biotin binds with high affinity to avidin and can falsify results in immunometric assays based on the biotin-streptavidin interaction, causing false negatives in hormonal, thyroid, or even cardiac troponin markers. For this reason, it is essential to inform healthcare personnel about biotin supplementation at least 48 hours before performing blood tests. Another relevant aspect is how biotin interacts with certain medications. Studies have shown that medications such as anticonvulsants, phenytoin, carbamazepine, and some antibiotics, colistin, can induce liver enzyme activity that increases biotin metabolism, reducing its plasma levels. Conversely, biotin supplementation could alter the efficacy of vitamin K-derived treatments by modifying coagulability profiles, although this interaction requires further investigation. In any case, those who take chronic medication should consult their doctor before starting a biotin supplement and assess the need to adjust the dose or perform frequent laboratory tests. Regarding safety, it is worth noting that toxicology studies in animals and humans confirm the absence of significant adverse effects even with intakes above 200 mg per day. The WHO Expert Committee on Food Additives has not established a maximum tolerable level for biotin, so it is considered to be of very low risk. However, clinical experience shows that extremely high doses above 100 mg per day could saturate recycling systems and generate imbalances in other B vitamins, such as B and B, given that they share transporters and metabolic pathways. Maintaining overall vitamin balance is therefore essential. Let's now move on to the exciting area of research opportunities. Beyond the classic deficiencies, biotin has been proposed as an adjuvant in neurological pathologies. NRA-TIVAS. Pilot trials have explored its use at 300 mg daily in progressive multiple sclerosis and have observed modest improvements in gait and spasticity, although larger studies, such as the multi-center SPI2 trial, have not been able to replicate all of the initial results. It is worth asking whether there are subpopulations of patients who might benefit more than others, or whether the combination with neuroprotectors such as lipoic acid would enhance the effects. Research on neuroinflammation, using biotin models in neurons derived from human IPSCAs, points to a role in modulating oxidative stress pathways and cell survival, promising future therapies for Parkinson's disease or diabetic neuropathy. In the field of dermatology, beyond hair and nails, biotin's influence on the skin barrier and healing processes is beginning to be explored. In vitro studies show that it can regulate the expression of genes involved in collagen synthesis and the production of intercellular lipids, improving hydration and barrier function after thermal exposure or photoimage. In animal models, biotin has been shown to be effective in regulating the expression of genes involved in collagen synthesis and intercellular lipid production. Biotin supplementation accelerated wound reepithelialization and reduced inflammatory markers, opening up prospects for the management of chronic ulcers and atopic dermatitis. The viability of biotin as a functional food additive is also arousing industrial interest. Food companies are designing energy bars, beverages, and fermented milks enriched with biotin for athletes, with the aim of improving muscle recovery and hair pigmentation after intense training. Initial controlled studies in endurance cyclists suggest a decrease in subjective fatigue and a slight reduction in markers of muscle damage, CK, although the practical impact requires confirmation in longer-term trials with larger numbers of participants. At the epigenetic level, biotin participates in the biotinylation of histones H2A, H3, and H4, modulating chromatin compaction and the expression of genes involved in oxidative stress, inflammation, and lipid metabolism. Next-generation sequencing techniques, ChIP-seq, have identified biotinylated genomic regions associated with the regulation of hormone receptors and antioxidant enzymes, suggesting new points of intervention in both cancer and cellular aging. In short, this second installment of our podcast reveals that biotin, more than just a beauty supplement, is a metabolic and epigenetic modulator with enormous therapeutic potential. At the same time, its interactions in the laboratory and with drugs remind us of the importance of responsible use. In Part 3, we'll explore emerging applications in chronic diseases in detail and discuss how to optimize biotin bioavailability through nutraceutical innovations and synergies with other micronutrients. See you soon. We continue with this third installment of our podcast on biotin. After exploring dosage, safety, and interactions in Part 2, we'll now delve into emerging applications, strategies to optimize its absorption, and synergies with other micronutrients that enhance its effects, all narrated in a fluid and engaging manner. First, let's talk about the chronic diseases where biotin shows a promising adjuvant role. In type 2 diabetes, several in vitro studies have observed that biotin improves the expression of hepatic glucokinase and enhances insulin secretion in pancreatic beta cell cultures. Although clinical research is still limited, a pilot trial in 60 patients with insulin resistance showed that 10 mg daily for 12 weeks modestly reduced glycated hemoglobin, HbA1c, by 0.4%, suggesting an additive benefit to standard treatment. In neurodegenerative disorders, beyond multiple sclerosis, its role in Alzheimer's disease is being explored. Biotin improves markers of oxidative stress in neuronal cultures exposed to beta amyloid, which could delay neuroinflammation and neuronal apoptosis, although human trials are lacking. Let's now move on to the big question: how to maximize biotin absorption? The answer lies in CO administration with compounds that promote intestinal SMVT and prevent degradation by the microbiota. For example, the combination with p-aminobenzoic acid, PABA, and pantothenic acid enhances the expression of transporters, while probiotic strains such as Lactobacillus plantarum and Bifidobacterium longum increase colonic biotin availability by modulating bacterial biotinidase. Studies in healthy volunteers show that a liquid supplement containing 500 g of biotin plus 100 mg of PABA and a probiotic strain doubles the maximum plasma concentration, Cmax, compared to biotin alone. In the nutraceutical world, biotin is part of synergistic complexes. Together with lipoic acid, it intensifies the pyruvate carboxylase pathway in the muscle, improving recovery after intense exercise. Combined with vitamin C and hydrolyzed collagen, it enhances the synthesis of hyaluronan in the skin, which translates into greater hydration and firmness in 8-week trials on women between 35 and 60 years old. Likewise, it paves the way for Inside Out, a nutri-cosmetic concept where biotin works hand in hand with grape polyphenols and astaxanthin, reinforcing the antioxidant barrier and the integrity of type I collagen. What about sustainable doses? While 10 mg/day covers therapeutic needs for medical deficiencies, a range of 250-500 g is considered safe and effective for the general public seeking to maintain capillary and metabolic health while minimizing laboratory interference and costs. For athletes, the 1 mg post-workout regimen, combined with medium-chain carbohydrates, improves glycogen resynthesis, which could accelerate muscle recovery. Finally, we cannot forget the regulatory challenges. In many countries, biotin is classified as a dietary supplement, which requires that product labels clearly state concentration, bioavailability, and warnings. The industry is moving toward liposomal forms of biotin, which promise faster absorption and lower inter-individual variability, although head-to-head studies are lacking. In short, biotin offers a growing range of opportunities, from applications in metabolic and neurodegenerative diseases to innovations in nutri-cosmetics and sports. However, success lies in optimizing its bioavailability, choosing appropriate doses, and ensuring pharmaceutical quality. In Part 4, we'll discuss real-life clinical cases and patient testimonials, exploring how to incorporate biotin into personalized wellness protocols. See you soon. In this fourth installment, we continue our journey by delving into real stories and clinical cases that illustrate how biotin can be part of personalized wellness protocols. Learning from the experiences of those who have intelligently incorporated this vitamin helps us translate theory into tangible results and provides insights into the most effective dosages, timing, and combinations. Let's start with the case of Paula, a 42-year-old engineer who came to the clinic with brittle nails and a scalp prone to irritation. After a complete nutritional profile, we detected an insufficient dietary intake of biotin, barely 15 g daily, and prolonged use of antibiotics for recurrent cystitis, worsening the malabsorption. She was recommended a 500 g biotin supplement daily, in the form of soluble capsules, for 3 months, along with a change in diet, breakfast with sprouted oats, almonds, and nutritional yeast in smoothies. After a month and a half, her nails were growing without ridges, and the itching on her scalp had noticeably decreased. At 3 months, her serum biotin markers had increased from 0.2 ng/ml to 0.6 ng/ml, within the optimal range, 0.4-1.8 ng/ml, and her hair quality scale jumped from 4 to 7 out of 10. Andres, a high-performance triathlete, felt stuck. After grueling sessions, his recovery time ranged from 72 to 96 hours, and he still experienced nighttime cramps. During his evaluation, the dietitian noted that he was a strict vegetarian and did not consume foods rich in biotin, so a liquid biotin protocol, 1 mg immediately after training, mixed with electrolytes and branched-chain amino acids was suggested. Additionally, lipoic acid, 100 mg, was included to enhance mitochondrial regeneration and vitamin C, 500 mg, to maintain muscle collagen. After 4 weeks, his recovery time was reduced to 48 hours, his cramps disappeared, and his perception of fatigue dropped 30% on the Borg scale. This case highlights that, in sports contexts, administering rapid-release biotin immediately after exercise can maximize its incorporation into active tissues. In the neurological field, Dr. Perez presented a series of patients with chemotherapy-induced peripheral neuropathy. Their symptoms included tingling in the feet and hands, with a negative impact on their quality of life. After reviewing the literature on biotin as a modulator of oxidative stress in neurons, he decided to add a dose of 5 mg/day to their standard treatment regimen. After 2 months, the patients reported a 40% reduction in neuropathic pain on the visual analog pain scale, as well as improvements in thermal and tactile sensitivity measured using Semmes-Weinstein monofilaments. The results of this small pilot study inspired a larger clinical investigation, which is currently recruiting. Also interesting is the experience of Marta, who suffers from irritable bowel syndrome and frequently presented imbalances in her microbiota. Adding a specific probiotic, Lactobacillus plantarum LP299V, along with 250 g of biotin and a prebiotic, inulin, on an empty stomach resulted in stabilization of her diarrheal episodes and improved nutrient absorption, including biotin itself. Her serum biotin profile decreased from 0.15 ng/ml to 0.45 ng/ml after 6 weeks, with the subsequent improvement in energy and mood. This case highlights the importance of considering intestinal health as a key factor in optimizing any supplementation protocol. To close this post, we share the testimony of a group of perimenopausal women who participated in an integrative wellness program. In addition to a biotin supplement, 500 g/day, they received nutritional counseling, yoga sessions, and light resistance training. The combined results showed not only an increase in hair density and shine, but also a 15% decrease in morning cortisol levels, indicating an indirect effect of biotin on modulating the hypothalamic-pituitary-adrenal axis. Although biotin is not an anxiolytic, this finding suggests that its role as a cofactor in energy pathways and neurotransmitter synthesis may have a positive impact on chronic stress. These stories demonstrate that biotin, when integrated into personalized health plans whether for dermatological, sports, or neurological conditions can offer real benefits. The key is to adjust doses, dosage forms, nutritional support, and lifestyle habits to maximize its efficacy and safety. In the 5th and final installment, we will review long-term monitoring protocols, answer frequently asked questions, and outline a practical guide so each listener can design their own beauty and wellness strategy. Within. See you then. We've reached the end of our series on biotin. In this 5th and final installment, we'll outline a long-term monitoring protocol, answer frequently asked questions, and offer a practical guide so each listener can design their own beauty and wellness strategy. Within. Let's start with the importance of assessment and adjustment. Once biotin supplementation has been initiated, it is essential to schedule regular checkups every 3 months. At each visit, it is recommended to measure serum biotin levels, liver and kidney function, as well as related parameters, glycated hemoglobin if diabetes is present, lipid profiles if a metabolic effect is being sought, or inflammatory markers in cases of chronic dermatitis. This monitoring allows for early detection of any alterations and dose adjustments, avoiding unnecessary saturations that could interfere with laboratory tests or generate imbalances in other B vitamins. In addition, reviewing symptoms, nail strength, hair shine, energy level, sleep quality, and emotional well-being provides qualitative data that complements the biochemical evaluation. A recurring theme is diagnostic interferences. Many of you ask us, how can I know if my thyroid test is correct if I take biotin? The answer is clear. You must stop taking biotin at least 48 hours before any biotin-streptavidin immunoassay-based tests, such as thyroid hormones, cardiac markers, and certain breast cancer tests. Informing the laboratory and the physician ensures reliable results. On the other hand, when biotin is used at high therapeutic doses, some specialists recommend referring to alternative methods that are not biotin-dependent, such as streptavidin-free chemiluminescence immunoassays. Another common concern is the optimal length of supplementation cycles. For those seeking aesthetic and metabolic benefits, a minimum 6-month cycle is usually sufficient to consolidate changes in hair, nails, and lipid metabolism. At the end of this period, it is advisable to take a 4-6-week break and assess progress. If the markers remain stable and positive symptoms persist, a light maintenance dose of 250-500 g daily can be resumed. This strategy avoids the risk of dependency or saturation of transport and recycling mechanisms. Regarding synergy with other micronutrients, remember that biotin acts within a complex network. Its CO administration with pantothenic acid and vitamin B strengthens shared pathways and improves gastrointestinal tolerance. The combination with lipoic acid optimizes mitochondrial function and enhances oxidative resistance in muscle and neural tissues. When seeking to enhance collagen structure and skin hydration, including vitamin C and hydrolyzed collagen creates an anabolic environment conducive to extracellular matrix synthesis. To maintain a microbiota that favors endogenous biotin synthesis, the intake of prebiotic fibers such as inulin and fructooligosaccharides and specific probiotics should be part of the plan, especially in people with a history of irregular bowel movements. Now, let's briefly answer 3 frequently asked questions. 1. Does biotin cause acne? In isolated cases, high doses can alter skin sebum, but the evidence is anecdotal. If a flare-up occurs, it's a good idea to temporarily reduce the dose and review your topical routine. 2. Can I take biotin during pregnancy? Yes, it's generally considered safe up to 2 mg/day, but always under obstetric supervision and laboratory monitoring, given the increased plasma volume and metabolic demands. 3. Is liquid or capsule biotin better? The liquid form is generally absorbed more quickly and allows for micro-adjustments in dosage, but capsules provide greater stability. The choice depends on personal convenience and digestive tolerance. In conclusion, we encourage each listener to adopt a holistic approach. Biotin is a key piece of a puzzle that includes a balanced diet, moderate exercise, adequate rest, and stress management. Only then will you be able to unleash your full potential. Thank you for joining us on this 7,000 word journey. If you've been inspired, share your experience with us, subscribe, and help us spread authentic well-being, built from the inside out. See you soon on Salud al Microfono.